I'm Rabbi Max Reynolds. I'm a chaplain at the Mount Sinai Hospital, where I work with both our palliative care and our spiritual care teams. During the height of the COVID pandemic here in New York City, I was a chaplain resident in the Mount Sinai Health System at Mount Sinai Beth Israel. The pandemic has, of course, uprooted much of our lives, and this includes our educational programs. Spiritual care is a contextual practice, though. We adapt to the circumstances of our lives and our times. We seek to understand what we need, what the people around us need, and how we can get those needs met. Chaplains, in so many ways, are the connective tissue that keep our hospitals together, supporting and nurturing the emotional processing of our patients, their families, and our staff. By doing this, we strengthen our relationships to each other and increase our collective resilience through difficult times. Through the height of the pandemic, my learning was upended. What had primarily been patient care became primarily staff care. I could only see patients and families through doors and phones and Zoom screens. I assisted our priest, who couldn't come to the hospital, in providing sacrament of the sick at the end of life by reciting the words he said as near to the patient as I could get. It was not a kind of chaplaincy I could have ever imagined. But chaplaincy is like that anyway. So often we're doing work we could never have really imagined. The space that my residency provided me through this asked me to be available to my feelings, aware of my past traumas as they played out through this global one we're all living in, and keeping myself dynamically connected to my learning cohort, my other spiritual care staff, my interdisciplinary teams, the hospital staff generally, and of course my patients. In the end, though this pandemic has been so hard and so painful, I can also say that my sense of vocation and authority as a chaplain, my sense of home in this work, are clearer than ever. This program has made me more available to my own self, my power, my call, my tradition, my imagination, and my emotional world than I would have imagined possible without it. Though I do not want any of us to have had come through these past few months of the coronavirus, I know too that I am where I belong, and I am honored to get to be here. Thank you.